I think we have enough people now to get started. So thank you so much to everyone joining us this evening. My name is Inez and I'm a patient officer here at the London Egg Bank. And today we have our lovely Dr. Dr Jain. She is a consultant in reproductive medicine, and of course she has over 10 years of experience with us. And today she'll be talking about our Freeze and Share program. We'll be talking through everything that includes regulations and laws around Freeze and Share, as well as the treatments involved. For the first part of the Q&A. And then at the end, we'll be going through some questions that you may have. So if you have any questions at any point, please do drop those on the chat and we'll be going through them at the end. I'll pass over to Dr. Tracy so she can also introduce herself.
Thank you, Ines, for a lovely introduction. And thank you, everyone, for sparing some time this evening. I hope you find the webinar useful. Of course, we'll take questions towards the end, as well as if there are some unanswered questions. If you have any follow-up questions, please feel free to contact us by email. So, as Ines mentioned, I'm one of the consultants at London Egg Bank. My name is Dr. Dr Jain. I've been working in the field of reproductive medicine, IVF, since the year 2012. So yes, I do have over 10 years of experience, and I've been working with London Egg Bank for a few years. So yes, so let's talk about Egg Freeze and Share. This is a very unique program London Egg Bank runs for patients who wish to freeze eggs virtually for free. And yeah, of course, there are certain criteria to be eligible for this program, but we'll talk about egg freezing as well as this program. I hope these slides run. Sometimes there's a little lag. Yeah. So egg freezing. Let's talk about what is egg freezing. You might have been hearing a lot about this in social media, with friends, from family. So we'll talk about egg freezing, what HFEA describes. HFEA is the Human Fertilization and Embryology Authority. They are the governing authority in the UK. They govern all fertility treatments in the UK. So HFEA says egg freezing is a method of preserving women's fertility, so fertility preservation, so she can try and have children at a later date. And HFEA has got a designated page for patients considering egg freezing, and I would highly recommend you go there. And they also mentioned that egg freezing, it's very important which clinic you do egg freezing at, as the experience of the clinic in freezing eggs is extremely important in providing success rates in future. Talking about history of egg freezing, there was first baby born using frozen egg in 2001 in the UK. And since then, egg freezing has become more popular. In last couple of years, it has taken a very sharp increase in the numbers of patients who are coming for egg freezing for various reasons. So yes, eggs have been frozen for over 20 years now. HFEA reports that there has been quite a significant increase in number of egg freezing cycles. And there was, within a year, there was 64% increase in the number of women in a year coming for egg freezing for fertility preservation. As HFEA mentioned, it's very important to consider carefully which clinic you freeze your eggs at, as experience in freezing and thawing eggs at that particular clinic can change your success rates in terms of pregnancy rates in future. So at London Egg Bank, we have over 10 years of experience in freezing eggs. We have over 50,000 eggs frozen in our clinic. And of those, we have used over 16,000 eggs. So eggs have been taken out of the freezer, egg thawing, we call it. Those have been fertilized with sperm, and we have had over 1,000 children born using frozen eggs. Why is egg freezing increasing? We are more aware that, women are more and more aware that age affects their chances of conceiving naturally. So there is significant age-related decline in women's fertility. Patients are more educated, as well as we are delaying childbearing for various reasons. Women are in professional career. They want to, enjoy life. They want to make their career before they become mothers. So more and more women are choosing, therefore, to delay childbearing, and freezing eggs give them autonomy in future. Of course, there is increased awareness on social media, press media, etc. Therefore, women are coming forward for egg freezing. There are a lot of celebrities who have spoken openly about their egg freezing journey, and they have described egg freezing as, it's like somebody described, it feels like a safety net, or you freeze your fertility on ice. So it's becoming more and more common, and it's not experimental anymore. It's a routine fertility treatment option. Not just the UK celebrities or Hollywood celebrities. Indian celebrity who's in Hollywood now, Priyanka Chopra, also had a child born using her frozen eggs. So we all talk about how does age affect fertility, and I will cover why it affects fertility. So there is quantitative as well as qualitative decline in women's fertility with age. Quantitative means the number of eggs are declining as we get older. At birth, women are born with a couple of million eggs. However, they do decline quite a lot. And if we look at the fertility, monthly fertility rate by age, in our 20s to 30, our fertility is stable, more or less. The orange curve is for women. And between our 20 and 30, our chances of conceiving are similar. However, after 30, there is a very steep decline in conceiving, chances of conceiving. And after age 40, chances of conceiving are less than 20%. In the men, on the other hand, they are very different to women. This blue curve is for men. Their chance of conceiving with age does not decline as sharply. There is a very minor change in the chances of them making their partners pregnant with age. We talked about why age affects chances of conceiving for two reasons. One is egg number declines. Secondly, egg quality declines. So this is a graph showing how egg number declines. So at birth, we are born with a couple of million eggs. However, even before our first period, around the time of puberty, by the time we have lost more than half of the eggs, they are dead already. So at puberty, we are left with around 300,000 eggs. And after that, there is a gradual decline in egg numbers until you're 30, and sharper decline after you're 30. So when we nearly run out of eggs, we have menopause. An average age of menopause in the UK is around 51 to 52 years, when we have less than 1,000 eggs left. So there is a number of eggs declining, as well as the quality of eggs is declining. The genetic material in the egg is not as healthy as we get older. Therefore, the risk of things like Down syndrome and other chromosomal abnormalities in the embryos created with older eggs increases significantly. So this is a graph showing what are the chances of having a genetically balanced embryo with your egg. If you are age 26, chance of having genetically balanced embryo from your eggs is 80%. But if you are 42 years of age, chance of having a balanced embryo, healthy embryo, is less than 20%. Therefore, if you freeze your eggs when you are younger and we use them in future, your chances of having healthier embryo are higher rather than taking eggs later when you are older. This is again another representation. What are your chances of conceiving as you get older? So if you are under 25 years of age, chances of conceiving naturally within a year is 96%. And this chance declines. And after you're 35, chances around 78% before 40, between 35 and 39 years of age. But after 40, chances are quite low. And if you haven't conceived, you're over 40 and you haven't conceived, or for 3 months of trying, you should seek medical help. It's likely you need fertility treatment. So what are the benefits and indications of egg freezing? Social egg freezing is for reasons that you want to delay childbearing. There is no exact medical cause, but you decided to have pregnancy later on in your life. So we can do social egg freezing, collect your eggs when you are younger and use them at a later age. By law, we can keep eggs frozen for up to 55 years in the UK. and egg quality does not decline despite keeping them in freezer for many years. So social egg freezing can be done. For example, if you're not ready to have a child as yet, you have not found the right partner with whom you want to have a baby with. You want to delay childbearing for various reasons, and you want to at the same time preserve your future options. I remember when I came in this field in 2012, my heart will go, I'll feel so emotional because at the time, women is 40 years of age, they never froze their eggs, and they are wanting to have a baby now. And we are like, you don't have a choice than to go for donor eggs. And we didn't have as many donors at that time, so they had very limited choices at that time. But now with egg freezing, we have more options. So talking about London Egg Bank's Freeze and Share program, this is a program for women who wish to freeze the eggs while they're younger, but at the same time, they are willing to donate half of their eggs to London Egg Bank for them to be used by some other women who need donor eggs in future. So this is the program for those group of women. So those wishing to help others by donating half of their collected eggs, and in return, as an incentive, you get a free egg freezing cycle. So you don't have to pay for medications or treatment or egg collection. There are certain criteria. These are some of the criteria. So you should be relatively younger, somewhere between age 21 to 33 years of age. You should be healthy, not smoking or not drinking excessive amount of alcohol. You should not have any significant medical or genetic condition which could affect your equality or the health of the child in future. You should be healthier weight, and your BMI should be between 18 to 28. BMI is something we calculate from your weight and height. And on the fertility tests, your results should suggest your ovarian reserve, your remaining egg number is relatively good. To assess your eligibility, whether your egg reserve, how's your egg reserve, you would require a blood test for a hormone called anti-Müllerian hormone, which is a hormone produced from ovaries, and higher the level of AMH is, better the egg reserve is. Also, we do a pelvic scan, vaginal scan, to assess your ovaries, and we count what we call antral follicle count. So we count number of follicles we can see on scan, and together these are the markers of egg reserve. And depending on what your results are like, we will then see if you could be eligible for this program, in addition to your medical history, weight, age, etc. Once you've done those two tests, you'll have a consultation with one of us, one of the consultants, like myself, Dr. Nair, or Dr. Vindola, just to name a few, to discuss your medical history, your results of the test, and to decide whether we could accept you for this program. Of course, the doctor will discuss your results. We'll also explore your medical family history as well as your own personal medical history and make informed decisions. We will, if you're accepted, we will then plan your treatment. So what dose of medications to give, how to stimulate your ovaries, etc. And you also would be required to attend a counseling session with our counselor to discuss implications of donating eggs. You may be aware that the children born using donor eggs, if they knew how they conceived, they could contact HFEA, the fertility regulator, at age 16 years of age. And when they're 18 years of age, if they wish to know, HFEA can disclose identifying details of the donor. So the counseling session is to discuss these aspects before you proceed with treatment. What does the treatment involve? Let's say you've done all the screening tests, you are accepted for the program. At some point before we start the treatment, we'll also need to do infection screening tests on you, like hepatitis B, C, HIV, as well as some genetic tests on you, like cystic fibrosis, thalassemia, etc. You don't have to pay for these tests if you're accepted for the program. And if these results come satisfactory, then only we can use your donated eggs. So what would the treatment involve? The medical side of it is that we will be giving you some injections of a hormone called FSH, follicle stimulating hormone. For 10 to 14 days before starting the injections, we'll do a scan to check your ovaries for any cyst and what is the follicle count near the time. If there is no cyst in the ovary and the follicle count is within acceptable range, we will start injections. And these injections help growing follicles. In a natural cycle, you usually grow only 1 or 2 follicles. In here, if we can, we want to grow 10 to 20 follicles. Your ovaries start to look like this with multiple follicles growing. And after 10 to 14 days, we will see when they're ready for egg collection. We do egg pickup. For egg collection, we put you to sleep. It's a minor surgical procedure done as a day case at our Harley Street clinic. And we do it vaginally. There is no cut or stitches. We go vaginally with a needle under ultrasound guidance. And you go home 1 to 2 hours later. Usually recovery and side effect wise, most of the women, 98% of the women would do well. It's normal, it's common to have some side effects. For example, mood changes emotionally. You can feel slightly up and down. For example, when you take hormonal contraceptive, very similar to those kind of side effects. It's common to feel bloated because you're growing a number of follicles that makes your ovaries big in size, giving you bloating. You can have some headache, usually manageable with simple measures. Some women can have a bit of bruising at the injection site. These side effects usually settle with time. They are temporary. In terms of risks, there is a condition called ovarian hyperstimulation syndrome, where ovaries can grow a lot of follicles and rarely ovaries can leak fluid. That usually settles with time and doesn't have long-term implications for your health. But yes, 1 to 2% women may feel unwell, may need hospital admission. Risk of injury is very low, it's less than 1 in 1,000. And risk of infection is low, it's less than 1%. So you go home 1 to 2 hours after egg collection. We will tell you how many eggs we managed to retrieve. Some eggs can be immature. Mature eggs are then frozen, half for you and half for London Egg Bank. In future, if you want to use your frozen eggs, you contact the clinic. Of course, you can try conceiving naturally first. If you didn't conceive naturally and you want to use your frozen eggs, at that point, you have to undergo what we call thawing of the eggs and fertilization of those eggs with sperm in the lab, called ICSI, intracytoplasmic sperm injection, where embryologists will thaw your eggs and the eggs which survive would be fertilized with the sperm. And after that, fertilized eggs are kept in our lab for 5 days, what we call blastocyst culture. And one good embryo is then put back inside your uterus, which is a simpler procedure to transfer the embryo inside the uterus. In terms of success rates, it can vary from patient to patient. But if we look at 100 patients, in terms of 100 eggs, let's say, usually we would see around 90 to 92% of those eggs would survive when we thaw them in future. So not every egg would survive the freezing and thawing process. And after the eggs which survived are fertilized with the sperm, usually 70 to 80% of them would fertilize. Looking at pregnancy rates, so when we transfer the blastocyst embryo in your uterus, pregnancy rates using frozen egg embryos depends on age of the women at the time of egg collection. As we accept women who are under 35 years of age for this program, you'll be looking at around 45% pregnancy rate with first embryo transfer. However, cumulative pregnancy rates, because it's likely you produce more than 1 embryos from a number of eggs you have in freezer. Cumulative pregnancy rates from set of eggs is higher, 70% or higher, depending upon how many embryos. If you produce 2 embryos, you'll be looking at 70% success rates. If you produce 3 embryos, you'll be looking at over 90% chances of live birth. It's a very common question patients ask: how many eggs should I freeze? How many eggs do I need to give me a good chance of pregnancy in future? So, of course, we can't give you 100% guarantee, but if you have 10 eggs or more, it gives you a reasonable chance of success. Every 10 frozen eggs, when we thaw them, around 8 to 9 of them would survive the thawing. 4 to 6 of them would fertilize with sperm. And every 10 eggs, we expect 1 to 3 embryos. So if you have 3 embryos, then you'll be looking at over 90% chance of success. If you have 2 embryos produce, 70% chance. If you have only 1 embryo, which can happen in around 5% cases, then it's around 45 to 50% chance. So considerations before you undergo this program is time and commitment. Of course, we will need you in clinic as well as online for consultation. In the clinic for various tests like blood test, your pelvic scan, as well as infection screening tests. So we need your time and commitment. You will need few appointments in person for investigations and monitoring scans leading to a collection. Consultations can be done online on Teams or Zoom, and you need to be available in the country during the treatment. You should be aware of short-term side effects, which are usually not long-lasting, they're short-term. You should be aware of small risk of complication like ovarian hyperstimulation syndrome, which again does not have long-term implications. It can be an emotional journey because unless we do the collection, it is difficult to predict exact outcome, how many eggs we'll get, how many of them would be mature. Very small risk of cycle cancellation if we thought we accepted you for program, but nearer the time, there is a cyst or follicle number is less than what we thought we had previously. Or unless we do the collection, we can't really predict exactly how many eggs we'll get in one go. So yes, it can be emotional journey. So we're here to support you. We have counselor, we have our patient coordinators, as well as doctors and nursing team to support. Again, misplaced expectations. So I would say take one step at a time. So as I said, unless we do the test, unless we do a collection, it's difficult to predict what will be the results and outcome like. In terms of next step, if you would like to be considered for this program, we would suggest you book a fertility health check, which includes a blood test for AMH, a pelvic scan to do follicle count, and a consultation with a consultant to discuss those results, review your medical history, to assess if you'd be accepted for this program. And if you are accepted provisionally for this program, then we'll book further screening tests like infection screening and genetic test. And if they're okay, we do carry on with treatment. We'll be happy to take questions to now. I don't know if Ines, you want to add anything for now?
Yes, I just wanted to go a little bit around the donation aspect of the program because, of course, freeze and share, you, of course, freezing the eggs for yourself, which is a lovely opportunity, but we also have to consider the donation aspect. And I kind of just want to go into the law a little bit around that. I think it's important that we are aware that egg donation is not an anonymous process. And this means that anybody born from your egg donation, once they become of age, they can actually request some information about yourselves. So from the age of 16, they can begin by requesting non-identifiable information. So this could be a little bit about your hobbies and your personality. And then at the age of 18, anybody born from your egg donation could request identifiable information. And this would be your name, your date and place of birth, and your last known postal address. This is something that cannot be opted out of because it's part of the law since 2005. However, it is completely up to you whether you'd like to make contact back with anybody born from your egg donation. So it is something to consider if you'd like to join the program, of course, because we need to help other families as well. Also, as part of the law in the UK, we can help a total of 10 families with your donation, which means that you can actually enter our freeze and share program up to 5 times. So you can do more than one cycle, of course, if our doctors deem that you're healthy enough to do so. And what this also means is that we then have to store your eggs. So in terms of the costs that come with the program, so of course, this is a very good alternative to just egg freezing because egg freezing is a very expensive process. And this is a little bit easier on the wallet. So it's a great program for that as well. So the freeze and share program comes with a total fee of £315. So that's 315. And what this fee covers is the initial fertility screening that Dr. Jain has talked us through. So is your AMH test, your blood and urine test, your ultrasound scan, and your consultation with our doctor after to find out about your results, as well as the counseling session. So all of this is included in the price that you're paying. The rest of the treatment is completely free of charge, as it's a goodwill gesture from us thanks to your donation. So that's all you're paying for. Once we collect your eggs, we then have to keep them somewhere. Of course, they have to be stored, and this comes with an annual fee of £390. That's 390 per year. And this value, of course, can change as the years go down, but this will just change with inflation. So we're not going to double or triple the price, so not to worry on that end. And of course, you'll always be contacted. And like I've mentioned earlier, you can do more than one cycle. And if you want to join us a couple of times, this still counts as a single storage for your eggs because they'll all be stored together. So the annual fee for storage will always remain at £390, independent of how many cycles you decide to do with us, which I think is quite important to go over as well. I think that is everything for me. Dr. Jain, do you have anything to add before we go through some of the questions?
No, I think we are good for now. We can move to questions. So Ines can answer non-medical questions and I will take medical questions. Please feel free to write as many questions as you can, because that would start a good discussion as well.
Perfect. So I'll start by reading some of the questions that have been put on the chat. So if you have PCOS, so I think this will be for you, Dr. Jain, will that be a problem, or is it even possible to collect more eggs?
It's a very good question and very commonly asked. PCOS is like, we don't mind PCOS basically, because PCOS means you have a large number of follicles in your ovaries. And so we do accept women with PCOS as long as the rest of your medical history is all right. Your BMI is okay, as some women with PCOS could be overweight. So as long as your AMH, follicle count, and rest of your medical history is satisfactory, we do accept women for PCOS. For freeze and share, there is more risk of ovarian hyperstimulation syndrome in women with PCOS. So we are more careful about how to stimulate. So you'll have low dose stimulation. So yeah, we have a different approach, different protocol to manage you well. Of course, as I mentioned, there is more risk of hyperstimulation syndrome. You're more likely to feel, if a higher number of eggs is collected, you're more likely to feel more bloated after egg pickup. But yes, we do accept.
Great, thank you very much. Next question is, can you do this fertility test abroad? So I think this is referring to the initial fertility screening. Our patient lives in Europe.
So, I mean, we do appreciate that it's very difficult for you to come from abroad just for the tests. And we do have a large number of international patients coming to London Egg Bank, not necessarily for this program, but for various reasons. So as long as if you can provide us a report, a formal test result, which does confirm the lab it was done at, and it is a signed formal report and it's in English, then we can possibly accept those. But yes, you can do it and share with us, and we can, let you know if we're able to accept those. So, I mean, before you go ahead and do the test, I would suggest you first fill a medical history form. So because once you have filled a medical history form, we just have initial assessment to see if this history is acceptable provisionally or not. And then if we say yes, we don't have any, contraindications we can think of, then you can go ahead and do the fertility tests abroad, and then we can review and decide further. Even if you do tests abroad, as I previously also mentioned, when there is, due to the nature of the treatment, it could be that after the tests are done until the treatment is started, there are a few months in between. So before we start injections to grow follicles, we'll be doing our own scan and we'll be assessing follicle count ourselves. If the follicle count is above certain number, then we continue start the injections and continue with the treatment. I hope that answers your question.
Okay, thank you very much. The next question is, if you wish to stop the process after the screening, do you only have to pay for the screening? So of course you can change your mind at any point. Our programs, you can redraw at any stage and there'll never be any consequence to you whatsoever. What you're paying for is just the initial screening. So once you've paid for that and you've had all your tests conducted and you've had a chat with the doctor, that's what you've paid for, and there's nothing else to pay. So if you would like to redraw after that, that is absolutely fine. There'll be no additional charges at any point of the program. Is there anything else you'd like to add to that, Dr. Jain?
Yes, I think Ines, you've answered it very well. I wanted to say that if you have any doubts in your mind, don't start the treatment. It's better to clear any doubts before you start injections, just to make your journey a bit smoother. Because once you start injections, it can be quite difficult for you to make a decision to stop, unless there is a medical reason to do so. Yes, and that's where comes counseling. So yes, you have a counseling session before we start the treatment to help make informed choices. But yes, it's absolutely entirely a voluntary process. At any point you feel uncomfortable, you wish to change your mind, that's your decision.
Perfect. Next question. Can parents who use donor eggs contact you during the process? So I think this question is whether recipient families would be able to contact you. So the question in short is no. So egg donation is completely anonymous between you as a donor and any recipient families. So they will never know who the donor was. It's just the child born from your egg donation. Once they become of age, they can find out a little bit more about yourselves. So the family, they will never be able to request any identifiable information about you as a donor.
But yes, the child can.
Yes.
And that's the rule in the UK. Child can contact HFEA. And if HFEA can then share donor's information. In that case, child can contact you.
Perfect. How soon can you go through another cycle after the first cycle of egg freezing?
So I think it depends upon the wait times during that time. Yeah, because we have a number of patients in the wait list. So it could be a couple of months, it could be immediately, it could be a few months. So it really depends on how busy we are at the time and how many patients are in wait list before you. Sometimes we have some recipients who are looking for a specific type of donor in terms of ethnicity. If that's the case, especially if you're ethnic minority and there is a recipient who wants donor eggs, we might then contact you that, are you willing to come earlier for second cycle, if that makes sense. But yes, it could be a couple of months, it could be more than a couple of months between two cycles.
Next question, do we have to go through IVF process with you, or can we use our eggs elsewhere for towing, etc.?
So it's entirely your choice. Majority of the people who froze eggs with us, they will go for IVF with us. Having said that, eggs can be transported easily to other clinic. Let's say if you moved out of London and it's better for you to have treatment in some other clinic local to you, so eggs can be transported to other clinic within the UK as well as outside the UK. Having said that, I would like you to be aware that not every clinic would be good at thawing frozen eggs, and it comes with experience and practice over years. So you should ensure that the clinic you're transporting eggs to, they are good, they have good success rates of thawing eggs and fertilizing them. And also that clinic needs to have a third-party contract with us. If they don't have a third-party contract, they can apply for. Now, talking about trans across the borders outside the UK, costs of transporting gametes would be significantly more. So yes, it can be done, but just consider those factors. Success rates of that clinic you want to transport eggs to, or how much it would cost to transport eggs to. But yes, at that point, you will be paying for IVF treatment, but you don't pay for egg collection because egg collection has already been done. So it would be lower than standard IVF costs.
Thank you very much. I am on the contraceptive pill. Would I need to stop taking, and how long before the screening, etc.?
So most of the contraceptive pills, especially the combined pills, which contains both estrogen and progesterone. So any combined hormonal contraceptives like combined pills, implant is not combined, it's a progesterone only, but it's a long-term contraceptive method. So any long-term hormonal contraceptives can affect how ovaries are behaving at the moment. So most of them work by affecting your ovulation. So it reduces the growth of follicles in your ovaries. So women who have been on long-term hormonal contraceptives, very commonly we see that we see less number of follicles when we scan you. So if you are on hormonal contraceptives, apart from Mirena is a hormonal contraceptive, which is a coil put inside the uterus. So apart from Mirena, if you're on other hormonal contraceptive, we would like you to have stopped it for 2 to 3 months before we would say, go come and do the AMH blood test or follicle count, because both AMH and follicle count are usually suppressed by those. So yes, this is what we would advise. If you're on Mirena, it's a bit more, tricky one. So Mirena mainly releases progesterone hormone within the uterus, and it works by thinning the lining of the uterus as a contraceptive rather than affecting your ovulation. So Mirena does not affect your AMH levels or follicle count as significantly. So if you're on Mirena, it's up to you whether you want to do first set of tests with Mirena in place, or you want to remove Mirena and do the test.
Thank you very much. During the 10 to 14 days of injections, how often do we have to come into the clinic?
So on average, you would need about 3 monitoring scans. So that means first scan is within 3 days of your period, when we are doing what we call a baseline scan, where we are checking if this is a good cycle to start injections or not. So we're looking for a cyst and what is your follicle count this month. So that is your first scan. Then we start injections if the results are good. And then you have another monitoring scan around day 6, day 7, and then one more scan around day 8, day 9, and then egg collection. So I would say three to 4 in-person visits for scan and egg collection altogether.
Okay, perfect. Moving on to our chat questions. The first question is, what if you are 34?
It's a tricky one. So if you're 34, your chances of having your good AMH and a follicle count is relatively less to be acceptable for this program. So it's a very tricky one. At the moment, we have a cutoff of under 34, but we can, individualize, we can consider what is your personal circumstances. So there's always, it's worth contacting us, and we'll discuss your particular case within our team and let you know. For example, if you have a child recently and you want to freeze eggs for second child, things could be different. So I think in your case, if you're 34 already, we'll have to take a team's decision.
Okay. Do you offer any aftercare? So for example, if there's any complications during egg collection procedure?
Yeah. So in the UK, if there is any complication, let's talk about ovarian herpes stimulation syndrome. So if you have a higher egg number than average, then there is more risk of OHSS. Usually we give you extra medications, something called Framidol, to reduce the risk of ovarian herpes stimulation syndrome. There would be, we also give you fluid before we discharge you to hydrate you well. There is nursing support, so we'll be in touch with you next day to check your well-being. Of course, if you're unwell, for example, if you're vomiting and you're not able to hydrate yourself at home, we do not have facility for inpatient treatment in our clinic. And this is the case with every fertility clinic. So if you're unwell and you can't keep yourself hydrated at home, you have to go to A&E. Local A&E, if you're in the UK, then it's NHS, and NHS would look after you. Now, if there is an injury, which chances are extremely, extremely low, then again, if you're unwell, you go to A&E locally. But we do keep an eye on you, we do support you, and we, as necessary, we can liaise with NHS consultant as well as required if you're very unwell, which chances are quite low. You also have long-term support. So you'll have a follow-up with the consultant after the first egg collection, a couple of weeks later, to discuss the outcome, to see how treatment went. And we can give you a better idea about whether you need another cycle, whether we can accept you for another cycle or not. Also, there is what we call donor welfare program also we run. So within a year of donation, if you have any gynecological problems, we can offer you a free scan and advise you what your scan is looking like. I don't know if Ines, you want to add
No, that is
something
all
else?
absolutely correct. Yeah, I'm actually the one that handles the donor welfare program, so I'll probably be in touch with some of you in a couple of years to invite you for that. So that'll be great. Um, the next question, I think we've already kind of answered it. Is there a deadline after our initial assessment for egg collections after your first one? So I think is the idea of repeat cycles yet again, and we've already said it may be a couple of months in between, unless of course we find you a great match before then. Um, is the freezing for 2 years? And is the freezing period from the last donation for multiple donations, if that makes sense?
Sorry, where is that question? Read that again, please.
Is the freezing for 2 years? And is the freezing period from the last donation for multiple
Oh, I
donations?
see. Okay. We used to have, previously, we used to offer egg freeze and share patients 2 years of free storage of eggs. However, due to increasing pressures on the clinic, recently management has taken this decision not to pay for storage anymore. So you have to, as I think Ines previously mentioned, was it 380 pounds?
90,
390
390.
pounds a year you pay for freezing costs. I think your other question is freezing. So basically, if you do second egg collection, your eggs collected in second egg collection would be added to same cohort of eggs from the previous egg collection.
Yes,
So you only pay freezing costs for one, even if you have had egg collection twice.
yes,
So it doesn't
exactly
matter if you have
correct.
10 eggs or 15 eggs, you still pay the same cost to keep them frozen every year.
Yes, absolutely. Will egg retrieval reduce chances of natural conception at a later date? Do I reduce the chance of a normal pregnancy by giving away some of my eggs now?
Not at all. So this is a very interesting question.
Yes.
And I would refer back to our slides where we learned that the egg number is declining as we are getting older. So every month, only one egg is released, one egg matures in your ovary and ovulate. However, there are hundreds to thousands of eggs every month are dying. So by doing a collection, we are supporting those follicles which would have died that month. We are supporting the growth of those follicles. So even if you do multiple egg collections for any reasons, you don't run out of eggs any earlier than natural decline. So egg collection, even multiple times, would not affect your egg number or egg quality or chances of conceiving naturally in future.
Right. I think the next question might be for myself. So,
Mhm.
how is it determined who receives the donated eggs? And that is a great question. So, we have a team in our building. They're called the matching team, and their job is literally to match donated eggs to recipients. And they do this by building profiles of donors. So, if you are to join us, you'll be asked loads of questions about yourself, about your personality, your career, your hobbies, etc. And we will build a profile on your behalf. And then this profile will be uploaded onto our database. And this is only accessible to recipient couples, of course. And they will then look at your characteristics, all the information you've given us about yourself, as well as some of your physical characteristics. They'll find out about your eye color, your hair color, your ethnicity, and then they will choose you based on that. So some people choose they have various things. So some people choose based on physical appearance. They'd like their future children to resemble them. Some of our recipients actually choose based on hobbies or career focus. So it really changes from person to person, but that is the idea. So while you remain fully anonymous, they'll still find out a little bit about you and be able to make that decision. So that's who chooses is always the recipient family. I hope that answered the question. Anything else you'd like to add to that, Dr. Jain?
No, I think you've answered it very well, Ines.
Yeah.
From my experience, when we talk about recipient and feedback we get them from them, yes, majority of them will go for similar physical features. But yes, I've had some patients, they're like, oh, I just read the profile, I just loved it, I just fall in love with what
Yeah.
the donor had written about themselves. So I think it depends what they attach when they read the profile of the donors with.
Great. And I think this may be our last question. So, is preconception genetic testing of the donor also part of the donation process? Thank you for your
That's
answer.
right. So when we talk about preconception genetic testing, we do test you for 8 things. One is we test your chromosomes, whether You've got 46XX women chromosome, female chromosomes. We also test you for something called Fragile X syndrome, cystic fibrosis, sickle cell, anemia, thalassemia, SMA, Tay-Sachs, and beta thalassemia. So alpha thalassemia, beta thalassemia. So yes, we do test you for 8 things, and we follow what is required by HFEA. So yes, you would kind of get an MOT done for free, and you don't pay for these tests. Now, of course, any test we do, we are responsible to discuss any abnormal results and what it means to you. Okay, so sometimes we learn that some of the patients we've tested, provisional donors we've tested, they could be screened positive as a carrier for things like cystic fibrosis or thalassemia or sickle cell. If any of your test results come abnormal, still, if you're a carrier of these conditions, you can still donate eggs. But we will test the male partner of women receiving your eggs for the same condition. If the male partner is negative, they can receive your eggs. Similarly, so if you're tested to be a carrier, we will arrange a call, a discussion with one of our team members to talk about what it means to you. And we would advise that when you want your own baby in future, we would advise your male partner or sperm provider to be tested for this same condition and make decisions accordingly. So if you are a carrier and your male partner is also a carrier of the same condition, then we can test embryos in future to avoid a child carrying the disease from 2 of you. So it's a complicated subject. I hope I answer your question. So you do get a free MOT. These are expensive tests to be done.
That is all correct. And there's one more question actually. So do the donors legally have to respond to the donor children if they get in contact? The short answer is the short answer is no. So it is completely up to you whether you wish to make contact back. Also, I didn't mention this earlier, but I think it's worth noting that our regulatory body, so the HFEA, which is the Human Fertilization and Embryology Authority, they will actually attempt to contact you, the donor, to let you know that somebody born from your egg donation is trying to request your information later on. So we'll try to give you a little heads up so you know somebody's trying to find out more about you. They do this by sending you a letter home. So we ask you to keep us, of course, up to date with your addresses so you don't miss out any of those heads up. So you will then perhaps know somebody may be able to contact me in the future, and it's up to you if you wish to make that contact back. But it's worth noting that it is within their right to always request this information about yourself, and this, of course, cannot be changed. Is also why we offer counseling. Our counselors, they're a great team that we have with us, and they discuss all these implications and how to handle and navigate should somebody try to contact you in the future. So if this is something that you're considering, we really, really suggest you talk with our counselors about this, and they will, of course, guide you, and they will give you all the resources for all these different scenarios. Dr. Jain, anything else you'd like to add?
You answered it pretty well. So yes, I think you should be, we expect you to be supportive if the child approaches you, because all of us have curiosity to know our genetic origin, not that they want some gain from you. You're not financially responsible at all for any children born. You're not their legal parent. You do not have any legal duties for any children born from your eggs. But yes, if they try to approach you, yes, it's good to know how would you be, how would you feel, and how would you navigate those issues in future before you do the donation.
And they've asked also, do you do any checking of illnesses the child may have before processing the egg? Do you discard eggs on that basis?
So as we mentioned, that we test you for 8 genetic conditions. So these are 8 conditions which are more common. They're genetically inherited, like cystic fibrosis. 1 in 25 white Caucasian population carry abnormal gene. Sickle cell anemia, thalassemia, they're more common in Asian and Middle Eastern population. So we do those genetic tests before we accept you for this, before we can donate you eggs. Now, talking about whether we can run any test on the egg itself, we can't. Yeah, once eggs are collected, what they are checked for is how they're looking under the microscope. Are they mature? Are they immature? Are they very premature? Okay. As well as, do those eggs look normal in shape and size? So only mature and normal looking eggs can be frozen for future use. Immature or abnormal looking eggs are discarded. So there is no test we can run on the egg. So egg can be normal, but they can still, so they could be a very normal egg donor and normal egg and normal sperm, but they could still produce abnormal embryo. So it's again a complicated subject. So we can't test eggs, but we can assess eggs whether they are mature or normal looking before we can use them.
Okay, thank you very much. I think these are all the questions for today. I think that we've run through them all. Any other questions before we wrap up at all by anybody? I don't see anybody typing either. So I think this is everything. Thank you so much to anybody that's joined us today. Of course, we always follow up with an email about everything that was discussed today as well. And if any of you have any questions, please do reach out to us. It is my job to, of course, pass over all of your queries or answer them. And that is everything for today. Is there anything else you'd like to add, Dr. Jain?
No, I think we are good. Good luck. I would just say good luck and thanks for your time today. And as I said, we're always here to answer any more questions which might come up after the session.
Perfect. I think that is everything.
Thank
Thank you
you.
very much. Thank you.
Bye-bye.